My name is Yael Haberman. I'm a pediatric gastroenterologist and a researcher. I have a dual faculty position at the Sheba Medical Center in Israel and in Cincinnati Children's, and this represents our overall vision to work as a big team with experts from around the world to move forward IBD research. I am delighted to be part of this IBD Strong event. My motivation for understanding IBD comes from the clinical observation that we see this increase in the incidence of the disease worldwide, and more so in children. This increase is likely linked with modern era dietary and environmental triggers, as well as with alteration in the gut bacteria. I'm also motivated by another clinical observation that even with our best therapies, we achieve mucosal healing and sustain remission in less than half of our patients. The disease affects the gut, and we therefore focus our research in the gut to capture the variation and the heterogeneity we see between patients. I can visualize the disease and evaluate the injured gut when I perform endoscopy. I look at the biopsies under the microscope and see the different layers of the involved gut. However, it is clear to all of us that more research is needed to try and understand what is it that we see. What causes IBD? Why some do not respond to therapy? Which other new drugs targets we should discover for those failing therapy? How will we know who will respond to which therapy, and what is the role for the diet and the gut bacteria and those conditions? Our goal in the lab is to try and understand the different biology in those that respond and not respond, and we look for new targets for future therapies and identify markers for response. Our research includes human cohorts, and we use samples from the gut to characterize interactions between the bacteria, the epithelial barrier, and the immune system in the affected lining of the gut. We use the clinical phenotype of the patient in addition to big data, different omics, and machine learning analysis. To test causalities, we are building models, and we use the disease tissue and the gut bacteria from the patients to build our personalized disease models. We can then determine causality. We can better understand what is the underlying barrier and metabolic dysfunction that we need to target, which bacteria are linked to the immune activation that we need to modify. We build those to test for causality, but also as a platform to test for new therapies. We can screen different drugs using those models and test for toxicities and effects before we move on to clinical trials in patients. We anticipate that those complementary approaches will ultimately guide us toward new targets for those who are failing existing therapies. I really want to thank you all for listening. As you can see, I'm very excited about IBD research, as there is still a lot to learn and improve. I hope research, including ours, will lead to new targeted and personalized innovative therapies that will improve the life of those living with IBD. I also love music and believe in its power to heal different types of wounds. So enjoy the music and the rest of your evening and continue this amazing work of supporting families and patients.